Okay, let's start. Thank you everybody for coming for the third day of this meeting. My name is Julien Potet. I work for Médecins Sans Frontières, MSF, and I'm very glad and honored to chair this session. During this session, we will travel to different countries and we'll speak about the management of snakebite primarily. And our first speaker is Professor Aniruddha Ghose, who's going to speak to us about management and epidemiology and management of snake bite by sea snakes in Bangladesh. So the floor is yours, and maybe you can upload your presentation first.
Okay, can I share my screen now?
Can you do it? Yes, I'll tell you, please.
Can you see the?
Yeah, we can see it. Thank you.
Okay, then I will start now. Good morning to everyone in Oxford, and good day to others who are listening on and viewing this online. Bangladesh is bordered on its south side by the Bay of Bengal, so it has a very long stretch of coastal belt or beach, and around 2 million are engaged in the marine fishing in the Bay of Bengal. And the bites by sea snake is supposed to be a common hazard which is feared by millions fishing at sea and in coastal waters. Back in 1991, a survey of more than 40 fishing villages from Teknaf, which is south to Chittagong, revealed only 2 cases of fatal sea snake bites remembered from previous 10 years. So we don't know much about the morbidity and mortality related to this sea fishing by the sea snake currently. So we tried to plan a study to describe the epidemiological pattern and events related to sea snake bite and to describe the clinical events, mortality and morbidity following the sea snake bite among selected communities of Bangladeshi fishermen in the Bay of Bengal. It was a questionnaire-based cross-sectional survey extending over 6 months, the whole study period, and it was done within the fishing communities at the Coxbazar, Shodor, Shamlapur, and Maheshkhali, which is an island. And these are the 3 areas in the southeast part of Bangladesh where this study was conducted. We approached the leaders of those communities and asked them to gather the fishermen on a specific day, and the fishermen which have the experience of any sea snake bite related events, either by himself or witnessed the bite of any of his peers. We thought that sea snake bite is a event that should be remembered by his peers also, and should be remembered by those who has experience of it over the last 5 or 10 years. There are 54 third-year MBBS students of Cox's Bazar Medical Colleges who volunteered for this study as who will be getting the answers from these fishermen. They were trained earlier, and later on they conducted this whole interview. We got 244 respondents there. The mean age was around 37, and you can see that almost all the respondents, or not almost all the respondents were male. The culturally, the fishing at sea is a main job in Cox's Bazar, and it is a very labor-intensive job, which explains that the age and the male sex phenomenon. And most of the respondents were in between 2nd to 6th decades of their life. And we could gather, or we could document 62, which is around 25% of the respondents being bitten by sea snakes at some point in their lifetime. And in their lifetime, the 25% were within 1 year, 50% within second to fifth year, and 22% were more than 5 years ago. They had the experience of the sea snake bite. And here the lower limb was affected more than the upper limb. Similarly, in another study in Malaya by Reed, Professor Reed, back in 1970s, they had also reported that most victims were bitten on their lower limb through trending on the snake. We think when the nets are collected on the decks of the ship, they were working on them and collecting the snakes, that is the time they were bitten, and that's why the lower limb was affected more than the upper limb. According to the statement of the patient, pain was the most common symptom in 54 or in 90% of this respondent, followed by bite site swelling, weakness, and anxiety. And according to their self-described signs, you can see that neurotoxicity, they had the features of neurotoxicity like the weakness, the neck muscles, drooping of the upper eyelid, difficulty in speaking, dysphagia, double vision, nasal regurgitation, and also they reported dark urine, which we took as the features of myotoxicity. And according to the statement of the patient, among the 62 patients, 6 cases suffered from severe life-threatening features. But remember that this is their statement of their illness. But we could not record any death or they could not remember any death of any of the fishermen. After the bite, half of those use some kind of treatment at the boat, applying some of the herbal medicines or taking some of the herbal drugs that they believe would cure this ailment. And the tourniquet was applied in around 50%. This is in contrast to the practice by the victims of the terrestrial snake bite, where we see a high rate of application of tourniquet, around 80 to 90% in Bangladesh. And the recommended immobilization was not practiced in most because they had no idea or never heard of this immobilization technique. And the treatment from OJA, as we see in the terrestrial bite, here the treatment was from OJA was not taken or was not very popular, as this happened in the mid-sea. And once they came back to the shore, they preferred to go to the hospital, and they reported going to the Upazila hospital, that is our primary healthcare center, the secondary healthcare center or district Sadar hospital, around 64% reported there, and 2 reported to consult the doctors in medical college hospitals, 2 of the victims. But later on, we tried to find out any of the reported or documented cases in these hospitals, but unfortunately, we failed to find out any. And the problem is there is a long way from the bite site in the mid of the sea and to the hospital premises, because it is a long, more in 50%, it takes around 12 hours to reach the shore. After that, they had to travel a long distance to get to the hospital. And you can see that the expense for the treatment, this is a very low income or low earning community in this fishermen or seagoing fishermen, and the economic burden that is in Bangladeshi taka, you can now easily calculate it in euro or dollar, 100 taka per dollar. This study has some limitations because this is only in a single site or only in the southeast part of Bangladesh. The other coastal areas along the south part of Bangladesh was not covered. There are many other sea fishermen communities there. And the most of the respondents shared their experiences and events by recall. So there may be a recall bias. But out of this, we want to conclude by saying that the prevalence of snakebite was found as around 25%. Patients' self-stated features suggest envenomation. Half of the patient did not seek any kind of treatment. In most cases, these cause an economic burden on the patient. The number of the cases with severe consequences and their potential for being fatal signifies the importance of this medical condition. There need to be measures to update awareness among the fishermen and also healthcare personnel, especially of the coastal areas, and educating the fishermen on identifying sea snakes and avoiding contact with sea snakes, especially while they are handling the fish and handling the net, could be an important preventive measure. We want to thank the teachers and students of Cox's Biomedical College, the fishermen of our study site who kindly agreed to come to for the interview, the local community leaders who arranged this, and Professor Dr. Ulrich Kuch for his advices regarding this. And I will finish it with an invitation for you to attend our 11th National Conference on Tropical Medicine and Toxicology on 25th and 26th November to be held in Sylhet, one of the divisional headquarters, and also to visit the Venom Research Center in Chittagong Medical College, where I am located. Thank you very much for your patient hearing.
Thank you very much for this very interesting talk. I have other questions in the audience. Yes, please. You can introduce yourself first.
Good morning. Thank you. I'm Ornella Rossetto from the University of Padova in Italy. Probably you have told us, but I missed the point. How long do the main symptoms last? Sorry, and are there any sequela that can last for a long period? Thank you.
Thank you, madam. But I didn't get your first question. Sequelae, regarding sequelae, I'm talking, but didn't get the first
How
question.
long do the symptoms last usually? The main symptoms, such as pain, weakness, and so on.
The main symptoms. Okay. I will start from from your second part, that there were some of the as you said, the sequelae. They said that yes, there remained some sequelae later on when after they were beaten, and the total duration of their illness, that depends on the severity of their illness of this, because the hospital stay, you can say that the hospital stay for some were more than 6 days. I think this is also in my presentation, that 6 patients reported they were hospitalized for less than 24 hours. 16 or 57% say that it was about a week. And for 6%, I probably would think that these are the severe cases. They had to stay in the hospital for more than a week, more than 7 days.
Thank you very much.
Thank you.
Any other comments or questions in the audience? No, maybe online. Anybody online would like to comment or ask a question? So maybe because we've got a bit of time, I can ask my question myself. I suppose that there are no specific antivenoms for these snakebite envenomings, correct? And yes, do we know if existing antivenoms have some sort of paraspecific activity at some point, or not at all?
We don't know whether they have any paraspecific specificity at all, because it was never tested. As you know that the antivenom we use is from the Indian origin antivenom against the so-called Indian Big Four, and the paraspecificity is never tested. Sorry.
Okay, thank you. Okay, thank you very much for your
I
presentation.
think from Roazana in the chat box asked a question.
Oh, please, can you read it?
Rezwana Arlin. Most probably fishermen unable to find out about sea snake bite and venomation. My question is, how can they find out about sea snake? Because I am a bit confused. Most probably the fisherman is unable to find out about the sea snake bite and venomation. One of the thing is that it is reported in the literature that many of the sea snake bite go unnoticed because of very small pain and others. But that was not in our cases. And it in the literature it was said that many a time that's why they don't notice it, or though they don't report it. But how can they find out about this snake bite? If this question is related to their upgrading their knowledge, we need to what to say, a public awareness program or awareness program among the community. Rezwana, I hope I could answer your question.
Well, thank you very much, Professor. And we'll move now to the second presentation, if you don't mind. Thank you.